injectable procedures. And I primarily use cryolipolysis and hyaluronic acid injection, both of which are a part of Allergan portfolios. I've been using cryolipolysis for more than 11 years. I present two case reports that combines these two techniques. I think lower face contouring is the combination of subtraction and addition. This is my recent method for lower face contouring. And this method is very simple and rational. Before diving into this, I'd like to talk about mechanism of lower face aging. As we age, the facial line of lower face begin to appear uneven, alternating area of fullness and hollowness along the jawline as shown here. Let's take a moment to consider the causes behind these changes. The area of fullness are caused by excess fat volume, while hollowness is a result from volume loss. You can see various types of aging signs around the lower face. Number 2 and 3 represent excess volume, whereas number 1, 4, and 5 indicate volume deficiency. In other words, excess volume obscures the definition of mandible line, and lack of volume leads to poor projection. If you treat someone like this patient, what would you do? I'd like to share my method. Number 1, 4, and 5 is addition by filler injection. Number 2 and 3 is subtraction by fat reduction machine. In short, we use fat reduction to reveal the mandible line that is hidden by excess fat, and then improve the contour and projection by hyaluronic acid injection. As a result, we can achieve a perfect jawline. The combination of subtraction and addition is highly rational approach. For subtraction treatment, we use cryolipolysis, and for addition, we use hyaluronic acid injection. Today, I'd like to share the case report demonstrating this method with you. This method was published on CCID last year, supported by Dr. Kapoor. Please read if you like it. Next, I'd like to talk about treatment flow of this method. At first, we perform 2 sessions of cryolipolysis 2 months interval, because more than 2 sessions of cryolipolysis makes visible result. And 2 months later, we followed by hyaluronic acid injection. And 2 weeks later, we evaluated. This process is subtraction. This process is addition. Now I will show the 2 case report. Case 1. She's in her 30s. She has a lot of fat around the lower face, and her facial line was obscured by excess fat. At the beginning, she underwent cryolipolysis for her submental fat. Now let's check the result of after cryolipolysis. From an oblique angle, you can see how mandible line has become clear only by reducing submental fat. This is a major result made by only cryolipolysis. But still, we can change her lower face more beautiful. She needs more pointed chin with forward cut, and we can create her facial line sharper. That's why we followed by hyaluronic acid injection. which enable to improve chin projection and create a sharp facial line. This table details which products were used for which area of the face. As there were no problems on her mid face, we inject only lower face. At first, we injected borax, mandible angle, to stretch the facial line. And we injected labial fold and chin apex to improve chin projection. And then we injected around mandible line, more improving chin projection and creating straight line. We use borax 3.75 milliliter in total. Let's check the result of all treatment flow. From the frontal view, cryolipolysis has reduced the fat around the face, lower face, after hyaluronic acid injection. Additionally, hyaluronic acid injection has slimmed down the width of the face, resulting in the sharper facial line. And 14 months from hyaluronic acid injection, she kept long-term outcome. From a rig angle, after hyaluronic acid injection, you can see the same result as well. Her overall impression has been changing, more attractive and feminine. This is 14 months from hyaluronic acid injection. Please take a look at it closely. All the contour of her jawline has started to softer stripe compared to the photo on the left. The hyaluronic acid injection still effectively maintaining the volume, so her appearance has not returned to the condition seen in the second photo from the left. Okay, let's move on to the case 2. In comparison to previous case, she has less submental fat. However, the fat becomes noticeable when her chin is pulled back. You might think that she doesn't need any treatment for her double chin, but she is typical Japanese lady who wants to become more skinny, despite already slim. Therefore, we also treated these cases. We did the combination treatment as well. Let's check the result of after cryolipolysis. From chin back position, you can see slight improvement of lateral side of submental fat. But center of submental fat still left. So we need hyaluronic acid injection. This slide shows injection site of case 2. We injected mid-face and the lower face. At first, we inject mid-face with volume to lift mid-cheek and to create cheek projection. And then we injected lower face with borax. We inject chin apex area to improve chin projection. And we injected along mandible line to create better chin projection and more beautiful facial line. Let's check the result of all treatment flow. After hyaluronic acid injection, you can see the big change rather than after cryolipolysis. Her chin projection improved, and her facial line has become sharper and make straight line. Her overall impression has become feminine and more attractive. From chin back position, cryolipolysis improved her double chin to some extent here, but hyaluronic acid injection made it much less noticeable. From a frontal view of chin back position, you can see the same result as well. Through this case, I can say how damaging is not attributed to subcutaneous fat, but also sagging from upper region. In this case, hyaluronic acid injection was more effective than cryolipolysis. The reason is heartburn under the gene was skin laxity rather than fat. Through these two cases, I found that for the patient with a lot of fat around their lower face, cryolipolysis should be first. For the patient with low fat, injection first. My strategy of low face contouring starts by determining whether the patient has excess fat in the lower face. If there is a certain amount of fat, I begin with fat reduction. It not only increases the effectiveness of the treatment, but also it ensures long-term sustainability. This is a big advantage. That's why this approach will elevate patient satisfaction. Thank you so much. Yes. Next, I'm going to introduce my model today. At first, I'll show the result of subtraction treatment. Okay? Treatment. She's in her 20s. She has a significant amount of fat around her face and slightly damaging. So we need 2 sections of cryolipolysis. After cryolipolysis, it has reduced the fat around her face. You can see her facial line has become sharp. From a weak angle, after cryolipolysis, you can see her facial line has become clear only by cryolipolysis. The other side. After cryolipolysis, you can see the same result as well. At this point, we've already done subtraction treatment, so next, let's move on to the addition treatment. Okay, that's all for my presentation. Next, let's move on to the live injection. Dr. Steven, could you give me a second? So the model is getting ready.
Absolutely. Thank you so much, Elaine.
I'm going back to you.
I think Dr. Fumiko demonstrated a very important concept. I think as an injector, the junior injectors, we've been taught to inject, to add. And sometimes to create that ideal shape, you also need to subtract. And she has shown this perfect combination of adding and reduction. And time we'll talk about the Leaching junction, and she had just demonstrated beautifully a nice demarcation of the face and the neck junction. So I think in years to come, you will hear more about the face neck junction as opposed to the Leaching junction that she's beautifully demonstrated. Now, before we move on to the demonstration of distinct definition, this will be the time if you have some questions. You have the opportunities to ask the questions, particularly in the second half when she's finished injecting. So you just have to raise your hand, and at the appropriate time we'll get you to ask the appropriate question. But if you can, just keep it short and succinct, just a very, very short question rather than it will take an hour to answer. Right? There are multiple ways you can reduce the contouring or the fat. Basically, the surgeon will know the efficiency of surgical intervention. Certain countries, North America, we also in Australia we actually have a chemical way of reducing it with the use of Belcara, and various other techniques, which is using a thermal way to reduce the fat. There are multiple devices there. Clearly, Kumiko has been using the lipo-CoolScope. So we are waiting
Yeah.
anxiously. So you're ready?
Yes, I'm ready. Thank you.
Okay.
Yes, Steven.
Go ahead.
Okay, can I start?
Sure.
Yeah. Now let's move on to the assessment briefly. So we've already